Welcome to the office. How are you?
I'm good.
Welcome to the office, Lauren. How can I help you?
I got a lot of things going on.
But hold on, you're local.
I'm local.
You said you sing opera.
Yeah.
I'm kind of excited about that.
Yeah.
Tell me about it.
It's good, but right now it's painful because I get muscle spasms. So I'll be singing,
Okay.
and all of a sudden I start
Are
feeling.
we talking like real operas, or are we talking like little playhouses?
Well, I'm training in opera.
You're in
I'm
training.
not performing in opera.
Okay, got it.
I'm an artist that sings rock music.
You're here because of the shoulder spasms and the rib pain. You have migraines that have been going on for a while now.
Yeah.
You get most of this when you're singing in terms of the spasms and the pain.
And lying down.
And what about the migraines? You get that all the time, every day?
Now it only started again like the last month.
Okay.
And like I said, it stopped around 2020, and then it started again this last month. And I say I get them pretty regular. Last month or two. TMJ
Okay.
also started again.
Okay.
I never had TMJ symptoms.
What
and
else?
it started this month.
It's all related. We're going to go over all that. What else?
So yeah, TMJ started this month. Migraine started about a month or two ago, and I get them every day. It almost is like it feels like a pinched nerve. I feel like I get tingly, loose sensation down my arm. Also, like I just feel both sides are kind of like tight here, so it's hard to know if it's muscular, if it's alignment. I'd use a lot of like Theragun to try and help, but it doesn't really. And then the rib almost feels like it's like behind my like right shoulder blade, like up underneath.
Okay.
And it usually feels really sharp, like it feels like it's going into my, like it's hard for my lungs to expand.
Ah, this is different.
Okay.
It's two separate things.
Okay.
Do you have difficulty taking in a breath when that happens? You're breathing through your mouth. Breathe through your nose. And do it a couple more times. Can you breathe through your diaphragm? I know you know how to breathe through your diaphragm. Because right now you're bringing like a person in fight or flight.
Let me try.
You're in fight or flight right now. The idea with the diaphragm or stomach breathing is the chest doesn't rise. So if the chest rises, there you go. Better.
It feels like something's in the way.
Yes. And that happens at the same time as the spasm.
When I'm doing my diaphragmatic breathing and I'm singing opera, I start to get a little bit dizzy and a little bit, and then this happens.
How's the back?
Back is good compared to everything else. I have a point on the right. I don't know if it's the hip or if it's the, what do you call the part that connects the hips?
Pelvis? The SI joint? Sacroiliac joint?
That one. At that point, just on the right side, it's kind of pinchy.
Okay.
And then my feet are kind of messed up, if you could take a look at that. And I think that's pretty much, let me check my notes, but I think that's, right bottom skull, just general skull. Like I'm mostly curious about that because most chiropractors are just too scared to even go there.
Why?
I don't know, because they're...
It was done like when you were a kid.
Yeah, but I
had one case when my first year in practice, and I think I had a lot of interesting cases my first year in practice.
Okay.
This particular one was a post-stroke patient. It was a hemorrhagic stroke. They ended up cutting his skull. About a third of his skull was missing for the surgery, and then they replaced it with a plastic cap.
No.
So the skull was basically 2/3 bone, 1/3 plastic.
Weird.
And we had to adjust him. I had to adjust him with this. Okay, it was a very interesting experience.
Yeah.
So it's not about if there's pressure there, it needs an adjustment, we need to figure it out.
Yeah.
Fair enough?
Yeah.
If there's no pressure, it's not coming from there, then we don't need to touch it.
I bet you'll find pressure.
I'm just saying though, the idea, you want an answer first.
Yeah.
So the idea of coming in here, are we in balance? Number one.
Yeah.
Number two, where's the pressure?
Yeah.
Number three is, what is the order we're going to correct this in?
Okay.
Fair enough?
Yeah.
Let's go over your x-rays.
Oh, sorry, one
Please.
more. I had a pituitary tumor removed in 2021, and they went through my nose, and I saw you give the woman with the TMJ a nose. If I'd just like to see if my nose, because they had
we'll
went
see if
through,
we need to do anything there.
just because they went up through
Tumor's
that.
out?
The tumor's out. I'm good. But
When was
sometimes
that
when I'm
surgery?
singing, I feel like things are a little bit.
When was that?
2021.
Okay. So this case, you're not a case, but this case,
Yeah.
as you present, as Lauren presents, she presents with a few things. Her motivating factor was the shoulder spasm and pain
The rib.
and the rib when you're singing, and you're not able to do what you love to do. That's number one.
Migraines,
Migraines,
close second.
and so no, but I'm saying is that kind of got you here. Migraines,
Yeah.
all that.
Yeah. The main thing also with us is like, if I can get resolution with my migraines here, I'd rather not get Botox. But if my migraines continue after us working together, I might
Fair
temporarily.
Fair enough. Come over here, have a seat. So here's the deal, Lauren. You're going to sit over here. We're going to go over your x-rays.
Okay.
I asked for 4 visits with all new patients, okay? And that can be in 4 days. That can be in 2 weeks.
Mm-hmm.
I don't like to go more than 4 days apart. And I want to be very clear about that with everybody, because I have a lot of people, they travel and they think I'm fixing everything in 4 days.
Okay.
I'm not.
Okay.
But today you get an answer.
Okay.
From the answer, we do the exam,
Okay.
figure out where we're going to start.
Okay.
Okay? And then I'll see you for a couple of visits, and then you'll know if you want to be here or not.
And you'll also be able to tell me like how much might be coming from the muscular side of things. And
Well, here's the thing about muscles, right? There's a very famous line. A good friend of mine even taught me this. She's a DPT, Doctor of Physical Therapy. And I love that she understands the relationship between the neuromuscular system. Muscles receive instruction, they don't give.
so it's more from the structure.
Muscles receive basic physiology and neurology. Muscles receive instruction, they don't give instruction. So they respond and react according to the situation, whether it is a structural issue, whether it's a chemical issue, whether it's a fight or flight endocrine issue, hormonal issue.
Yeah.
It's responding or reacting to a situation.
Yeah.
Muscles move bones, right? Then we have stabilizers. If a muscle is spasming, I'm very clear about this, and I talked about it in videos 20 years old.
Okay.
A muscle spasm, usually anywhere in the body, but especially in the spine, a muscle spasm is your body, or that part of the body, splinting. It's protecting an area that's not stable.
Oh.
So the question is, why is it not stable? And if it's not stable, relaxing it isn't the answer.
Interesting.
And what happens over time, a spasm is energetically very expensive.
Yeah.
So
I'm exhausted.
you get tired. I've talked about this for 20 years. So a spasm is energetically very expensive, and eventually what will happen, which is probably where it's going now, the spasm turns into stiffness. The stiffness is now the ligament shortening to this new issue. The stiffness in the morning is ligament.
Wow.
And it gets better as the day goes, and then it gets tight at the end of the day. That's a different system.
So this may not even be fibromyalgia. This may just be my body.
So I'm going to
protecting
put something out there. Whether they keep it or not, I don't know. And I was trained in fibromyalgia 20 plus years ago.
Okay.
And the title that was taught to us was lactic acidosis.
Okay.
Which means what? Too much
Buildup of lactic
acid in the muscle.
Yeah.
Which comes from digestion, metabolism, B1 deficiency. So I was very successful in my early years when people came, because it was a big diagnosis. When there was no answer as to why this female has overall body pain, she has fibromyalgia. If it was a male, you have chronic fatigue syndrome. So it's 2 different diagnoses for the same thing. And back then we were treating it with a very specific B1 complex in a certain ratio with adjustments.
I take a B12 complex, but if you have a specific one that you suggest.
Yeah, it's not B12.
Oh.
B12 is good, but it's not the answer.
You have one that you.
Yeah, we'll talk about all that.
Oh, exciting. Because you do the functional medicine too, right?
Lactic acidosis is what AKA fibromyalgia used to be called 20 plus years
Really?
ago. Yeah.
That's interesting.
You ready?
I'm ready.
Let's get started. When we're looking at the side profile, we're looking at a few things. Number one, we're looking at the overall posture. Posture line, we take it from the lowest lumbar, L5, we run it straight up. And this line should bisect the base of the neck here. It should line up here.
Whoa.
So, yeah, so what it's showing us, follow my process. I'm going to teach you something really cool today. All of you. Okay? You see how far back it is. So the upper part of your building is behind the foundation. So all these muscles are working overtime just to hold you upright.
Is that posture?
That's posture.
Okay.
Okay, that's not the cause.
So it's need to be.
It's a result of the other stuff.
Okay.
So posture number one, yes.
Okay.
Number two, we look at curve. This curve is decent up until there, and then it kicks back and it's straight. There's no curve in your thoracic spine.
Mm-hmm.
But because your upper part is behind your foundation, you have actually the reverse curve, whether you want to call it reverse curve, cervical kyphosis, tech neck, whatever you want to call it. Everybody's got. But what I'm trying to show you here in your neck, that your body is compensating, otherwise you're falling back. You're off balance. So the body is innately trying to balance you out. Does that make sense? That's number two. Number three, the reverse curve in your neck, C5, C6, is what controls the shoulder and underneath the scapula that you're complaining about. However, it's compensating because it's a reverse curve. So you can get it adjusted all day long. It's never going to fix the problem.
Posture.
We got to fix the foundation.
Oh, okay.
And you got to work on getting this curve the right way. You're still young enough, you can do it. Okay?
So that's me kind of like going like
It's
this
habits.
versus.
It's habits.
Okay.
So we'll work on the structural part and that stuff. So the point of this x-ray is you're out of balance, okay? That we need to get the spine forward and you need to develop the right curve here. Does that make sense?
Yeah.
Now I'm going to go deeper. You ready?
Yeah.
Dun 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 dun. Doo-doo-doo. So you've had a couple of good injuries in your tailbone over the years, whether they were recent or old ones growing up. Where'd you grow up?
San Francisco.
San Francisco, okay. So first thing I'm seeing S1 open in the back, S1, 2, 3, 4, and something around S4, S5, this down in the tailbone area. This is important, and as a singer or in music, and I like to explain the coccyx this way. The spinal cord ends at L1, okay, and it becomes a string. That string, the filum terminale, ends here at the tip of the coccyx. So the coccyx maintains the tone of your entire central nervous system.
Really?
Yes. And now watch this. There's a couple of cool pieces of information. If the coccyx goes anterior like this, it loosens up the tone of the entire cord.
Whoa.
So that the entire being is off.
That's fascinating.
If it pulls it back, it's too tight. Think about it. Guitar string, if it's too loose or too tight, it's off tone, right? The tune is off.
Yeah.
Same with the person.
How does that part of the, like, how does that affect, why is it so closely related to tone?
Because it's maintaining the tension of the whole spinal cord. Look, the spinal cord starts here, right in the brainstem. It goes down here.
So if that's...
It stops at L1, it becomes a string. The string is held by the coccyx.
Wow.
Make sense?
Yeah. And mine's too...
Yours, it's just off.
Okay.
Okay? So that's point one. The other part of this, when we're looking at toning or tuning, is if it goes forward, it's too loose. If it goes back, it's too tight.
Okay.
And the idea is if it's off, I want to first make sure I sort that out. Okay? That's number one. Number two is your L5. So when we look at your discs here, these are all good. This one is off, it's tilted, starting at 5. But I can't work on the first floor unless the basement is right. Get it? Okay. This is all good. You're wearing out a little bit more in the mid-back, and that, again, that's posture. You're putting more weight distribution right here in the middle of the back. I'm going to get you moving again. You're going to move. The goal is 10,000 steps, okay? You see this reverse. 2, 3, 4, 5. If C6 is there, I'll deal with it. I don't need to mess with any of this. This is all compensating. If there's anything in the upper cervical, I will deal with it. Okay?
Okay. Nothing you see for pinched nerve yet, right?
Well, that I'm going to find on the exam.
Oh, okay.
Okay? If you want me to say C6, yeah, C6 is swollen in the back. C6 is the nerve that goes to your shoulder, goes to the hand, it goes behind the subscapular muscle.
You can see that it's swollen?
Yeah, I can see that it's swollen compared to the rest.
Interesting.
Now let's talk about this. This is you. This is looking at you from behind, which said the foundation is not right. So let's look at your foundation and talk about it. So looking at the foundation here, we can see this. Your right pelvis goes down, PI, out. The right sacrum goes back, 5. Goes down 2, and then the whole thing goes down 2. If I adjust your pelvis, I will make you worse. 2 becomes 4. So the answer is not there at the moment. So it tells me you probably had some old tailbone injuries first, and then something happened in the pelvis along the way. Okay, whatever it is. The fix is going to be really in the tailbone. Okay?
Could that be causing the discomfort on that? Right?
Absolutely, absolutely. So we got to start in the foundation, then we got to move up to the first floor.
Okay.
Make sense?
Yes.
As we move up, look, so 5 is tilted, it takes this whole thing, it turns to this left side, it then kinks over to the right, comes back again to left, so it's kind of going back and forth like that. I'm trying to see where you have your staples. I don't really see staples. I see these outlines here. I see a nose ring. I do see a left side deviated. Your left nostril is clogged compared to your right. Your airway is good on your right. Your left is a little bit clogged.
Okay.
And on your TMJ, we have a left deviated TMJ, right compensated TMJ, according to the X-ray. Could be different on what I see with you, but let's find out.
So weird, the staples don't show up on my other X-rays. They do.
I love to see them.
I think I have.
Look.
Do you
But
want me-
look here,
Oh,
no,
okay.
just look. Those are your earrings.
Yeah.
Okay. You ready to get started?
Yeah. Do you want me to find the other X-rays? or
It's not going to affect my treatment.
no? Okay.
You can send them to me though, so I have them on record.
Yeah.
Okay.
Is there anything that you see on my skull area that's kind of like?
All of it is referral from the reverse curve, right? The idea is not. The idea is we got to get this sorted out. Your weight distribution of your skull is wrong. You're putting too much stress on your spine. So if the curve is going the right way, there's less tension in your head. So you're creating a lot of this also from your posture.
Okay.
We'll find the nerve pressure today. We'll get it started.
Okay.
And we'll make some habit changes.
Okay.
Okay?
So that could be with the weight gain from everything.
The inflammation is a component, yes. You ready?
Yeah.
Let's start by scoping, starting at the base of the neck. And the first thing we're getting is 15 points. Looks like the left, and then it switches to the right. And now as we run it a few times, it's going to stay on the right. So just showing us how she has a lot of compensation going on here in the body. I'm opening the back, okay, ma'am? We need to talk about digestion and all that stuff. There's just a lot of stuff you got going on. And right now the main thing is balance, okay? T8, T9, left side, 5 points. Doo-doo, doo-doo, doo-doo-doo. There you are. 10 points, sacrum, left side. That's down in S4, dude. S3, S4, T8, T9. And C1, maybe occiput on the left side. And we also have T3. Okay, let's do some static palpation. Static palpation, and looking at overall, you can see there's really, we don't have the right curvature here. Curves in, comes out, curves in, comes out. We want to see a little more smoothness. Now, when you're saying weight gain and all that, you have a lot of inflammation, man. And there's a big discrepancy, and I always like to tell people this. Weight gain that's been fast, right, is usually inflammation, not fat. Weight that comes on and off fast is usually inflammation, okay? And when I look at your body, there's more inflammation, okay? So working on doing something that's gonna reduce your weight, but it's the wrong physiology, doesn't make sense.
Right.
You follow me?
Yeah.
Okay. 3. Yeah, this is all inflammation. You can see it as I'm running my fingers down. All the way down to the bottom. Okay. Let's check the pelvis and the sacrum. Back slowly towards me, please. All the way back. That's L5. A little tender.
Just a little.
S1, S2, S3, S4, S5. That's the one I'm feeling. Now, if I go back further, tender, or that one?
Oh, that one more.
T8 or T9?
I couldn't tell, sorry.
I feel T8 swelling. T9 is also swollen. T10 is not bad. T9. T8. T8, S3. Hi. Scoot forward a little bit. Okay. And let's go ahead and check the neck. C1. Sit back slowly, just to there. Left ear down. C1. Nod your head. Right side. That's occiput. Left side. Interesting. Head down. This is the occiput. Right there. You feel that one? Occiput. Okay, stand up for me. Let's watch you walk. Take your time. Come around this way, please. And you're going to walk back and forth, straight line, please. Look straight ahead, please. Just normal walking back and forth. Don't think so much. You can see she pronates both sides, more on the right side. And she kind of swings that right leg when she walks. Okay. Come over here, have a seat. Let's formulate a game plan. We're going to do the right occiput. We're going to do S3, sorry. That's the parasympathetic nervous system. After we do that, I'll have you walk. Then we'll check the TMJ.
Okay.
Okay?
Cool.
And we'll work on the feet and shoulders. I don't work on knees on first visit. I don't think we need to anyway.
Okay.
All right?
Okay.
You ready?
Can I ask you to see if this is normal right here?
What's that?
Just like the sculpt like that. Is that normal?
Well, compared to what?
I don't know. Other people sculpt like...
Everyone's different.
Really?
Don't compare yourself to anybody. You're you. You're you. No, honestly, I mean, it feels different than my head.
Yeah.
But everyone's head is different.
In terms of the pressure and that kind of thing.
What do you mean?
Well, that's like where I get a lot of pressure.
I understand. So are you asking me if the shape of your skull is causing your migraine?
Yes.
That's not the right question.
Oh, no.
No.
Okay.
I found pressure in the nervous system.
Okay.
Now remember, we can have people with variants. Everyone has a variant. This is important. You need to understand it.
Okay.
Everyone is born different. Everyone has different shit. There's only one of us. There's only one of you, one of me, one of her. There's only one of you.
Yeah.
And there will only ever be one of you. There will never be a copy of you in the future, and there never was a copy in the past. So we have to balance with nature. What is natural for you is not natural for her or me. It's different for everybody.
Yeah.
So the point I'm making, it's really important, everybody gets this. It's getting you in balance, not comparing you to me. Does that make sense?
Yeah.
So there is pressure in the occiput. Let's clear the pressure and see what happens.
Let's do it.
Fair enough?
Okay.
Okay. You got it? Nice and easy there. Sit back a little bit right there. Hi.
Oh my gosh. Not the singing.
Chin back. Do, a deer, a female deer.
Oh god. He wants to be a singer.
I really did back in the day.
Ooh, that's a good one. Oh.
That was a home run. Just talking about. Give it a second. That was a deep one. Stand up and walk it off. Check it out. That was nice. Check it out. All right, step up onto the table here, please. On the black platform. Yep. There you go. And what we'll do is we're going to set the S4. And it's down a little bit, we said, on the left side, so we got to torque it up. Yes? There. Relax the shoulders. That's the home run, lady. Gotcha.
I think I felt that in my head. Is that possible? Or that's just crazy talk.
No, it's not. I had a lady with TMJ. I adjusted her sacrum and it released her TMJ. Anything is possible. Step back, check it out. And now walk.
Ooh.
Take your time. Take your time. Should feel very different now.
Huh.
Crazy, right? Move your right shoulder.
It's more open.
Yeah.
Don't make me sing again. It feels, everything has more space.
Have a seat. Let's continue, please. Starting at the base. Occiput is clear. That cleared up your T8, T9. We don't need to mess with that for today. Sacrum is clear. Check it out. All the way back, all the way back, all the way back, all the way back, all the way back. Yo. All the way back, all the way back. There you go. All right, young lady, let's continue. Drop it down.
Okay.
Drop. That's it. It's not your shoulders. Go on your back, please. Let's work on your ankles.
Whoa, those ears.
Yeah. Now you can hear me better.
That's wild.
On your back.
Okay, here?
Yeah. You asked for it.
Okay.
Raise your leg. Breathe. Breathe. Raise your right leg. Breathe. There you go. But I got to do it. Come on up. Okay, now what I'd like you to do, go ahead, Lauren, and walk again. As you're walking, tell me what's different. Any and all.
Neck is more, sorry, neck has more space and less like, less impinged, or I don't know really.
Less pressure.
Yeah. I can hear my voice more.
Ah.
Like my voice is more resonant, which is insane. This is like, it feels like I just did a vocal warm up. That's crazy.
Walking in LA.
Hello.
Hello.
Like how, it's a little cuckoo. That's possible? That like.
Don't ask me. Everything is.
But that's
possible.
not in my head, right? Like
No.
I can almost, the voice is resonating more in my head.
We just cleared up pressure in your skull, dude.
So then it's
Opened up
moving
your
more
ears.
easily through.
Yeah, have a seat.
That is so cool. And this is like, I can feel like I can extend this better here.
Okay.
It's not, I think before I wasn't doing a full extension of this leg.
Have a seat. I gotta give you a buff and polish now. Now you get the buff and polish.
This is still a little,
Yeah.
oh.
You understand where it's coming from? Imbalance, instability, from compensation of your foundation and reverse curve.
Interesting.
And,
So-
if you're trying to fix it, so to speak, like there's a 1-2 magic thing, it's not.
It's not.
It's not, dude.
You didn't even do when you were on there, that's when you cleared up the rib area?
I did the sacrum.
And that affected the rib?
I didn't need to mess with it. That was affected by the upper cervical.
So those two areas were affecting the...
Everything. But I haven't checked the rib.
Okay.
Take a deep breath in though, it should be different. Don't rush, okay? Lauren, you're local. It's not that I'm gonna do all of this in one visit for you. I can, it's not gonna hold. That should already be different,
Yeah.
right? But I will check the rib, come.
Okay.
Let's go back down.
Yeah, this feels better. Oh, sorry, I'm supposed to go first.
Walking in LA, walking in
What are
LA.
your favorite music influences?
You don't want to hear it.
I do.
I mean, everybody who watches my videos, they know I'm old school, 80s, a lot of 80s rap.
Like who?
I mean, you name it. You name it. Started off with Grandmaster Flash and the Furious Five, and Run DMC, and Boogie Down Productions, all those guys.
Origins.
That one more tender, that one, or that one? That one?
Between the first and the third? I think the first.
Okay, no.
I'm wrong?
You're thinking. You should know it right away. You should feel it. If I'm doing this, okay, look, it's either that one or that one.
The first.
That one
First.
or that one.
First.
Okay, you see the difference in the way you answer? It's like, it all hurts, I know. I mean, it's all red from what I just did.
Yeah.
Deep breath in, blow it out on full expiration. There you go. One more deep breath in, blow it out fast. That's it. Okay. All right, young lady, you're all set for today. One second, dude. Walking in LA. All right. Nobody walks in LA. I was actually also a big new wave guy.
Oh yeah?
I loved my new wave. When it was K-Rock back in the 80s.
Huh.
Richard Blade, K-Rock.
I'm feeling this left ankle, though. Is that...
There's nothing else to do today, okay?
Okay.
Now you have to get used to it.
So
Come
just-
over here, check the hands. Yeah, there's nothing else to do there.
Okay.
Squeeze the hand. Squeeze. Squeeze.
Ooh. Tricky.
It's tricky. It's tricky.
Tricky,
Tricky, tricky, tricky. It's cracky. Squeeze. Squeeze. All right, madam, that's where we're going to start.
Thank you.
Welcome to the office.
I appreciate you.
You got it.